is better if you don't resist.
This wasn't a horror movie. It wasn't even a crime. It wasn't some back alley butcher operating in the dark. It was a legitimate Nobel Prize-winning medical procedure performed in hospitals on thousands of people and endorsed by the medical establishment. Covered in newspapers as a miracle of modern science. It was called the lobotomy. And this is the story of how it went from ancient skulls and primitive drills to ice picks in hospital corridors, and how, for a few catastrophic decades, the medical world convinced itself that the best way to heal the human mind was to destroy it. This story doesn't have a clean villain. That's what makes it so disturbing. It has brilliant people making monstrous decisions, well-intentioned doctors leaving a trail of broken human beings, a Nobel Prize given for something that should have been prosecuted. And it started as most dark chapters in history, just like the guillotine, not with evil, but with a problem nobody knew how to solve. Long before anyone had a theory about the human mind, someone decided to drill a hole in a human skull, and somehow that person survived. We know this because archaeologists have found skulls from the Neolithic period. We are talking 7,000-8,000 years ago, with perfectly circular holes cut into the bone. And here's the thing that makes it even stranger. Around those holes, the bone had healed. New tissue had grown back, meaning whoever had that hole drilled in their head didn't die on the table. They lived, possibly for years afterward. The procedure is called trepanation, and it's been found on every inhabited continent. Ancient Peru especially has an almost absurd number of trepan skulls, some of them showing multiple procedures on the same individual with evidence of recovery each time. Why were they doing this, you ask? We can only guess, but the prevailing theory, and it appears in cultures across the world completely independently, is that people believed the skull was a container, a vessel, and if something had gone wrong inside, if a person was behaving erratically, suffering from serious seizures, hearing voices, then maybe, just maybe, the answer was to open the container and let the demons out. It sounds absurd to us now, but think about it from their perspective. Someone you know has changed. They are not themselves. They are violent or terrified or unreachable. You have no concept of neurons or neurotransmitters or brain chemistry. What you have is a skull, a sharp rock, and desperation. So you drill. Thousands of years passed and tools improved. The Greeks and Romans developed proper trepanation instruments, drill-like devices that physicians like Galen used on patients with skull fractures or what was described as madness. The Middle Ages give us something even more revealing, a painting called The Extraction of the Stone of Madness. In it, a surgeon is cutting into a man's head while onlookers watch. The idea was literal, that insanity was a physical object in the brain and if you could just get in there and remove it, the person would be cured. It reads like superstition to us now, but the instinct underneath it, that a mental illness has a physical location in the brain and that you could, in theory, operate on it, that instinct was not entirely wrong. It was just catastrophically premature. The modern chapter of this story begins in 1848. A railroad construction worker in Vermont named Phineas Gage. Gage was by all accounts a solid, responsible, dependent man and good at his job. While he was performing the routine task of tamping explosives powder into a borehole with an iron rod, the powder ignited. The rod, a full 43-inch long, weighing over 6 pounds, shot upward like a rocket. It entered below his left cheekbone, passed completely through his skull, and exited out the top of his head. And Gage did not die. He sat up. He talked to the men around him. He rode in a cart to the nearest doctor, sitting upright. He was coherent. His physical recovery was genuinely remarkable. But the people who knew him noticed something immediately. They started noticing that he became different. The man who came back from the accident was not the man who had been there before. He became impulsive, unreliable, and foul-mouthed. He couldn't hold a job. He made decisions that made no sense. He had lost, as the people around him put it, something essential, something that made him him. His doctor wrote that he was no longer Gage, and this single accident became one of the first pieces of real evidence that personality is not a soul floating free of the body. It lives in the brain, specifically in the frontal lobes. And if something in the brain could destroy personality, maybe, just maybe, something could change it. That thought would eventually justify horrors. By the early 20th century, psychiatric hospitals across the Western world were quietly becoming warehouses. Men and women diagnosed with schizophrenia, severe depression, obsessive conditions, or almost anything that made them difficult to manage were committed, sometimes indefinitely. The treatments available were brutal and mostly ineffective. Cold baths, restraints, induced seizures, insulin coma therapy in which patients were put into hypoglycemic comas for days at a time. Nothing really worked, but the hospitals were full. Into this world steps a Portuguese neurologist named António Egas Moniz. Moniz was not a man without accomplishments. In 1927, he invented cerebral angiography, a technique using contrast dye to visualize the blood vessels of the brain. For the first time, doctors could see inside a living brain without cutting into it. It was a genuine landmark. He was nominated for a Nobel Prize, but he didn't get it. And something about that sat with him. In 1935, Moniz attended a neurology conference in London. There, two American researchers, John Fulton and Carl I. Jacobson, presented something that changed the direction of his career. They had removed large portions of the prefrontal cortex from two chimpanzees. The animals survived, but they were different. They were calm, docile. The anxiety and frustration they had shown before the surgery, gone. They had almost lost significant cognitive function. Their ability to learn, to problem solve, to navigate their environment, dramatically reduced. But They were calm. Moniz walked out of that conference with an idea burning in his head. If you disrupt the connections between the frontal lobe and the rest of the brain, not remove them entirely, just cut the wires, could you do the same thing in humans? Could you take a person in the grip of severe psychiatric illness and quiet them? He was 61 years old. He had gout so severe he couldn't operate himself. He had a window and he knew it. He found a neurosurgeon named Almeida Lima to perform the operations, and in 1936 they began. The procedure was called a lobotomy. A hole drilled into the skull, a probe inserted into the frontal lobe which severs the white matter, a connective tissue of the brain. Their first 20 patients were people who had been deemed untreatable. They had severe psychosis or chronic anxiety, conditions that had resisted every other intervention. Moniz reported that 7 were cured, 7 improved, and that 6 showed no change. What he did not report, what apparently did not interest him, was what happened to them following his procedures. No long-term follow-up, and no systematic attempt to understand the actual quality of life of the people whose brains had been cut out. They became calm, and calmness to Moniz was success. The medical community was skeptical. Questions about methodology, about ethics, about what exactly cured meant when what you've done was sever parts of a person's brain. But Moniz did not engage with the critics. He went on to publish his work, got promoted, and was invited to many conferences. And in 1949, 13 years after those first 20 operations, the Nobel Committee awarded António Egas Moniz the Nobel Prize in Physiology or Medicine, the most controversial Nobel Prize in history. A prize that, as we'll see, helped legitimize what was about to become one of the darkest chapters in the history of medicine. Walter Freeman did not invent the lobotomy, but he industrialized it. Freeman was an American psychiatrist who became obsessed with Moniz's work almost the moment he heard about it. In 1936, he partnered with neurosurgeon James Watts and performed the first prefrontal lobotomy in the United States. Their patient was a 63-year-old woman named Alice Hammett, a housewife from Kansas. She had spent years cycling in and out of psychiatric hospitals, gripped by anxiety so severe it made normal life impossible. The operation took about an hour. Freeman and Watts followed Moniz's method: the drill, the probe, and the sever of white matter. Afterward, Alice had seizures for several months, but her anxiety disappeared. She never had another panic attack. Her husband said the 5 years after the operation were the happiest of her life. She died at 68 of pneumonia, with no recurrence of her psychiatric symptoms. Freeman called it a success, and by some measures, for Alice, it was. But the story was about to get much more complicated. World War II flooded American psychiatric hospitals with broken men. Veterans coming home from the Pacific and from Europe with what we now call PTSD. But what they called it back then was shell shock, combat exhaustion, or simply nervous breakdown. The hospitals of the Department of Defense were overwhelmed, understaffed, and underfunded. Lobotomy suddenly looked like a solution. not because it healed people, but because it made them manageable. A calm patient is a cheap patient. A passive patient doesn't fight nurses or scream at night or require intensive supervision. The math was not complicated. Freeman saw the moment clearly, and he decided the bottleneck was the procedure itself. So, he simplified it. He took an ordinary ice pick from the kitchen and modified it slightly, gave it a more surgical name, the orbitoclast, and developed what he called the transorbital lobotomy. The patient would be rendered unconscious with electroconvulsive shock, running electric current through the brain until it ceased. Then, Freeman would place the tip of the ice pick above the eye socket, raise a mallet, and drive it through the thin bone behind the eye into the frontal lobe. 2 or 3 twists, severing the connections, and that's it, done. It takes only 10 minutes, sometimes even less. No surgeon required, no operating room, and no drill. $25 please and thank you. You can't get any cheaper than that. The first transorbital patient was Sally Ellen Ionesco, a 29-year-old woman that is prone to suicidal behavior. Freeman performed the procedure. Her memory was impaired afterward, but she retained normal function. She lived in what her family described as a relatively normal life. Freeman counted it a success. And then came Rosemary Kennedy. Rosemary Kennedy was the 3rd child of Joseph and Rose Kennedy. She was born in 1918, and her birth had been complicated. The doctor was late, and a nurse, trying to prevent delivery until he arrived, held the baby's head in the birth canal. The oxygen deprivation left Rosemary with intellectual disabilities. She grew up in the shadow of one of the most ambitious families in America. Her brothers would become war heroes, senators, a president, and an attorney general. Rosemary struggled to read and write. Her math skills at 15 were those of a 9-year-old. As she grew older, she became harder to manage with mood swings and episodes of anger. She also had a tendency to slip away from her carers and reportedly make her way to bars and the company of men, a behavior that terrified her father, obsessively protective of the family image. Joseph Kennedy had heard about Freeman's procedure. He arranged the operation. He did not tell his wife Rose. He did not, as far as the record shows, meaningfully consult Rosemary. She was 23 years old when Freeman and Watts operated on her. James Watts later described the operation in terms that are genuinely difficult to hear. This detail will stay with you.
We went through the top of her head. She was awake. We made a surgical incision into the brain through the skull near the forehead. The instrument looked like a butter knife. I moved it up and down to cut the brain tissue. Dr. Freeman began asking Rosemary questions, reciting the Lord's Prayer, singing God Bless America, counting backwards. We assessed how much to cut based on her responses.
When she began speaking incoherently, they stopped. And as you might have guessed, the damage was irreversible. The Rosemary Kennedy who emerged from the operating room had the mental development of a 2-year-old. She could barely recognize people. Only her sister Eunice remained familiar to her. Her speech became incoherent. She lost control of the movement of her limbs. The warm, dancing, swimming young woman who had struggled but been present in the world gone. Joseph Kennedy placed her in a private institution in Wisconsin. For 20 years, her existence was hidden. The family did not speak of her publicly. Her mother, Rose, would later say she didn't know where Rosemary was for years. She lived until 2005 in a care facility, having lost 6 decades of her life to an ice pick and a father who was ashamed of her. Freeman knew about Rosemary Kennedy. He knew about the results, but he kept going. By the late 1940s, Walter Freeman had become a brand, something that no physician should ever be. He loaded his procedure into a customized van, which people only half jokingly called the lobotomobile, and embarked on a grim crusade across the United States, drifting from one state asylum to the next like the Dark Knight, teaching his transorbital technique to whomever would learn it and performing the procedure himself on patients he'd never met before. These were rogue surgeries performed in rooms never meant for medicine, far from the safety of an operating table with specialized equipment. He had no medical backup and no safety net if something went wrong. He was fast and cheap, and he had the authority of someone who had been doing this for decades with the apparent blessing of the medical establishment. The $25 price tag made him accessible to hospitals with no budget. The 10-minute speed with no surgeon needed made him scalable. He wasn't just performing lobotomies, he was building a movement. The patients who came to Freeman were not all severely ill. This is the part that doesn't get talked about enough. Yes, some were schizophrenic patients who had been institutionalized for years, but others were people with anxiety, depression, and obsessive compulsive behaviors, with what was vaguely described as emotional instability. Some were homosexual in an era where homosexuality was classified as a mental disorder, and families sometimes committed relatives whose sexuality they found shameful. Some were children. The youngest patient Freeman lobotomized was 4 years old. Howard Dolly was 12 when his stepmother brought him to Freeman. By his own account, he wasn't violent or dangerous. He was a difficult child. He talked back, and his stepmother wanted him compliant. Freeman diagnosed him with schizophrenia after 2 short consultations and scheduled the operation. His father signed the consent form. Dolly spent decades not fully understanding what had been done to him. He wrote about it eventually in a memoir called My Lobotomy. He said that for most of his adult life, he felt like something was missing, a piece of him he could never quite find. Freeman's mortality rate was around 15%. At least 600 people are known to have died directly from his procedures. And that's the documented count in an era of poor record keeping. The true number is almost certainly higher. There was the photographer, a man who was present in the room when Freeman was performing a procedure. At one point, Freeman paused for a picture. The ice pick went in too deep. The patient died on the table. Freeman noted this incident in his records, and you guessed it, he kept going. By the time he finally retired in 1967, and I mean retired, not arrested, stripped of his license, or prosecuted, he walked away a free man, with his reputation intact. Walter Freeman had performed at least 4,000 lobotomies across 23 states, often using the actual ice pick from his kitchen. In the United States, an estimated 50,000 Americans underwent some form of lobotomy between 1936 and 1967. Many of them were left passive, mute, hollowed out, unable to care for themselves. Some were unable to form new memories. Others, like Rosemary Kennedy, were effectively removed from the human world for the remainder of their lives. The lobotomy didn't end because someone finally said enough. It ended because something better came along. In the mid-1950s, the first antipsychotic medication was introduced. For the first time, doctors had a chemical tool that could actually reduce psychotic symptoms without destroying the brain. Other medications followed. The pharmaceutical revolution in psychiatry made the lobotomy not just ethically indefensible, but simply unnecessary. Freeman's last lobotomy was performed in 1967 on a woman named Helen Mortensen. She was a patient he had operated on twice before. The third operation caused brain hemorrhaging. She died 3 days later. His hospital privileges were revoked and he died in 1972. He never expressed any regrets. In 2005, the Nobel Committee was asked whether they would revoke the prize awarded to Moniz in 1949. They declined. Nobel Prizes, they said, are not rescinded. If you found our stories fascinating, please like, subscribe, and support us. All the links are in the description below. Thank you very much for your support.